Okay, many thanks to Vayomanasa Sanjeevani and all the people who have joined here. I'm honored to be here to share my experience and knowledge about this particular issue. I'm sure this is a concerning and burning topic for many of the elderly people. First thing and foremost, my background has been shared. I'm a nephrologist, medical nephrologist who deal with the medical kidney disease as well as kidney bladder as well as prostate conditions. So prostate conditions are quite that is seen in the elderly population, elderly men, and there are many issues with this and which needs to be discussed in detail with the patients. So I'm not going to go into detailed medical information. I will give the talk which is appropriate for the general public. So first and foremost, this is the prostate, which is situated in the lower part of our abdomen. So this is a part of our external genitalia system, and the main job of the prostate is to help with the reproduction of the males. So it is encasing the urinary system just outside the bladder and encases the urethra. So prostate is normally a very small organ, which is the size of around 2 to 3 centimeters in the younger adults. As we reach the age of middle ages, around 50 and above, this prostate starts enlarging in size and starts encasing the urethra. So this prostate's main function is as a part of a reproductive system for men. So it helps to liquefy the semen and helps the movement of the spermatozoa. It helps in reproduction and it helps in smooth movement of the spermatozoa. As the reproductive function starts reducing, the spermatozoa production starts reducing, and this organ has got no specific function, but it starts increasing in size because part of the gland is under the suppression of testosterone hormone, that is a reproductive hormone. Once the testosterone hormone production reduces, this gland becomes a bit more prominent and active and becomes bigger in size. This is the physiological response. So this gland, as it gets bigger, it causes some medical problems with these patients. Now, the biggest question I was asked by many people in this Vayomanasa Sanjeevani as well as in my clinical practice is, some patients, actually many people will get a comprehensive health checkup, and they do get a test which is including some like a cancer screening test. Prostate-specific antigen is screened as a cancer screening test and is done for many people. And the people will come back and ask me, what is this, doctor? What is the implication of this? So this is a particular protein which is produced by the prostate gland in a very small amounts, and it circulates in the blood in a small amount. So this is the main role for this in the reproductive age group is to fluidify, like liquefy this semen. And as I said, it does circulate in a very small quantity, and if you do blood test, it will be picked up. So the test which confirms the PSA is a blood test. It's a very simple blood test, just like checking the kidney functions, liver functions. A simple blood test can identify this. So this is actually a screening test for prostate cancer as well as the test for monitoring the progress of the prostate cancer. Of course, this hormone is released because of many other conditions apart from prostate cancer, and that is what I want to emphasize on today in the meeting today. So this can be increased because of different situations. As we get older, there's more hormone release. When there is any sort of infection in the prostate or in the kidneys, bladder, it will cause rise in the prostate hormone level. and some prostatic conditions. So this is the normal prostatic specific antigen levels in the patients. So if someone is less than 50, it's very, very small amount, less than 2.5 nanograms per milliliter. And as we get older, the hormone levels rises. So what are the reasons why this hormone level rises? Commonest and what you call it as a benign situation will be in a young person, it's because of recent sexual activity ejaculation, digital rectal examination where a patient's backside is examined with a finger examination. Patient or person has done a vigorous exercise, cycling, swimming, and things like that. This is common. This is a natural variation in the levels. It can be elevated in a patient who's got what we call it as a benign prostatic hyperplasia. I will discuss these conditions. An infection of the prostate gland called prostatitis or the prostate cancer. Okay, coming to this condition of benign prostatic hyperplasia. As I mentioned, we men get older, our reproductive health reduces, and then the spermatozoa production reduces and testosterone hormone production reduces. That is when this gland gets physiologically bigger in size. It's just a hormonal change because of age as well as hormonal differences. So the gland gets bigger and it encases the urinary passage that is called urethra. So the most common symptom is the patients do experience that they need to go to the toilet very often. Especially in the nighttime, they wake up frequently to go and pass urine. They may have a very poor stream of urine. When they try to strain the urinary passage, they won't feel that urine is coming out smoothly. And even after passing urine, they feel that there is still some urine in their bladder. So they want to go back to pass urine. They should not have any pain and they should not have any discomfort. They should not have any blood in the urine and they should not have any fever. These are the important differentiated things. This is a benign condition wherein they will have just increased frequency of urine and difficulty in passing urine. How do you diagnose this condition? You see a doctor, usually a specialist in the urological sciences and nephrology, who will do a full examination, and that includes the examination of the back, that is to look at the prostate, a feel of the prostate by the doctor. It's called digital rectal examination. A prostate-specific antigen test, which is as per the doctor's advice, and we will do an ultrasound of the lower part of the abdomen to confirm the diagnosis. Okay, as I said, this is a physiological variation, and if only when the patient is symptomatic with difficulty in passing urine, we will be advising any medications. The most important lifestyle measures that is recommended is try to reduce the caffeine use, because caffeine increases the swelling of the prostate gland, and also try to reduce the amount of fluid we drink after 5 o'clock in the evening. No, you drink more water, you tend to go to the toilet more often in the nighttime. And we do use some medications for the patients as per their other medical conditions and comorbidities. And these medicines are simple, once in a day medications. Very, very rarely, if the gland is very big and it is causing more and more discomfort to the patient, we do suggest that the patient undergoes a very small operation that is called transurethral resection of prostate. That is a cystoscopic examination where we pass a camera tube into the urethra, and under direct vision, we will do a small operation to remove a part of the prostate that is obstructing the urinary passage system. And rarely a laser therapy is also recommended, but it's as per the doctor's advice. And as I said, it's very rare that we subject a patient for a surgical intervention in this particular condition. And it's quite common seen in people up to the age of 50. Next condition, which is a little more serious, is called prostatitis. So it's an infection of the prostate gland. So usually the patients will have frequent problem with urine tract infection. It's like when the patient has difficulty in passing urine because of benign prostatic hyperplasia, the urine stagnation can lead to infection in the urinary system. And this infection presents in the form of difficulty and painful urination. They may have pain, flu-like symptoms, and very rarely blood in the urine. So these patients will have fever is the most important presenting finding symptom, and then difficulty in passing urine, painful micturition. Okay, so this condition is to be treated with antibiotics and pain relievers. Usually hot fermentation is also recommended in the pelvic area to reduce the swelling and the pain. Usually with antibiotics, this condition subsides. And there's a chance that this condition may come back, then the doctors will assess to see whether there's any need of further intervention. Now, the biggest concern for everybody is whether this is a cancer. Yes, this is the biggest scare because, people will be worried that it's a concern. It's because it's a life-threatening situation. And the PSA result automatically warrants an assessment. Okay. Prostate cancer is again, it's a progression of benign prostatic hyperplasia, or sometimes it's an abnormal growth of the gland, which is purely beyond control of the hormonal imbalance. Who is at risk of prostate cancer? As a clinician, it's very, very difficult to say who is at risk of prostate cancer because it's many, many factors that can be associated with that. Older age, much older, and the conditions like benign prostatic hyperplasia. If someone has had a family history of prostatic cancer, increased fatty food intake are some of the predisposing factors which have been promoted as causative factors. But if you ask me as a doctor, I cannot pinpoint that this is the risk factor for prostate cancer specifically. Most importantly is a family history. No, these patients, in the early stages, they may not have any symptoms or symptoms exactly similar to the benign prostatic hyperplasia. But in the later stages, they may, and most importantly, they may present with blood in the urine, painful micturition, and then advanced symptoms will be in the form of metastasis, that is in the cancer spread to other parts, which includes bone. The commonest spread will be to the bone. So prostate cancer is diagnosed as prostate antigen test. Digital rectal examination is the initial screening investigation. And then we have to do further imaging after the ultrasound. If there is any suspicion on ultrasound, they'll proceed with more imaging. It could be MRI of the pelvic area. There is a definite indication for a biopsy of the prostate gland to confirm the diagnosis. And then they will decide whether there is a need for a further imaging to see if there is any spread of the cancer. How do we treat this condition? So if it is a very low risk and early stages, there is no specific treatment which is advised. Just monitor these patients and reduce the size with the medications with active surveillance. The surgical treatment is complete removal of the prostate gland. We call it as radical prostatectomy, and radiation therapy or chemotherapy in advanced cases. Now, the importance of prostate-specific antigen in prostate cancer screening. Okay, as I mentioned, usually if the level of prostate antigen is less than 4, it's unlikely to be suggestive of malignancy. If the prostate-specific antigen is more than 10, that raises a concern that it could be a cancer, and then we need to investigate this further. Just a result of high prostate-specific antigen does not say that the patient has a cancer. We need to investigate thoroughly and confirm the diagnosis. So this is where the screening will be useful. And if the PSA is between 4 to 10, there is something called a prostate-specific antigen in a different form. It's called prostate health index, which is provided or is available in some advanced centers, and that is at the discretion of the doctor who's assessing the patient, if they want to avoid any unnecessary surgical or invasive investigations. The prostate health index will give us an idea whether there is an abnormal prostatic specific antigen because of the cancer or is just because of the physiological variation. The benefit of prostate specific antigen is in early detection of the cancer. Of course, if you detect the cancer early, treatment is better and this is a life-saving treatment. But anything we do without a clear indication increase the risk of false positives. For example, if I have a perfectly healthy individual who just has a screening test and they include prostate-specific antigen, it comes back as 5 or 6 for that matter. It's probably a falsely positive test and unnecessarily increase the risk of patients getting anxious, worried. It increases the risk of overdiagnosis. We subject them to further imaging and investigations, including a surgical assessment, a biopsy, and things like that. So any test which is done without a proper indication is useless. So of course, this PSA test is very useful in a patient who's confirmed prostatic cancer, where we use this test to monitor the response to treatment. If the PSA levels are initially high, confirmed diagnosis of prostate cancer, and then we monitor the level that it comes down nicely, that suggests that the patient has responded nicely to the treatment. And at the same time, we monitor the PSA free periodically on follow-up to see if there is any rise in the titers that will suggest that there is a possibility of the cancer coming back. So important thing is that reduced it's a trend of prostate-specific antigen, which is more useful than a single value for the result. So again, controversies will be whether routine testing is recommended. Probably not. It actually increases the risk of overdiagnosis when this person has got no symptoms. It is useful when someone is symptomatic with any prostatic symptoms. So it's always, we discuss with our patients on usefulness of a test to see whether it helps the patient or not. Of course, it helps in high-risk patients. So my conclusion will be that prostate problem is not uncommon. It's quite commonly seen in older people. Of course, getting a doctor to assess and regular screening is crucial for early detection. Good dietary advice will be to eat healthy vegetable-based diet and reduced fat intake. Active lifestyle and healthy weight can reduce the risk of swelling or prostate health. So, with regards to prostate-specific antigen testing, I will suggest that you should speak to your healthcare provider and they will advise on the usefulness of the test. This is my last slide. Thank you. I'm happy to take any questions.
Thank you, sir, for this presentation. And apart from this main topic, there are also certain concerns and certain myths which are very common in the general public, such as the treatment for prostate cancer often causes impotence or incontinence. What are your views regarding this, sir?
Yes, I mean, even the treatment for prostatic hyperplasia and prostate cancer, both of them involves the instrumentation of the urethra and increase the risk of incontinence of the urine. But there will be advice from us as how to manage this. It's mainly by what do you call it as a toilet training as well as a healthy toilet technique, frequent urination, and avoiding excessive fluid intake in the nighttime is the treatment. Sometimes we use medications and also can be used to control the urine frequency. can see.
Yes. And if suppose any individual is completely asymptomatic, so does that exclude the need for any kind of screening or any kind of consultation with your physician as we age? Or should we go for any specific interval consultation with our physician, like every couple of years or couple of months?
Okay. Actually, with this
At a particular
screening is
age?
every 2 years. Okay. Screening is done in the range of every 2 yearly prostate-specific antigen test in patients, and also it includes the clinical examination, history, as well as prostate-specific antigen. Only single test doesn't really mean anything to the patient. So screening will be when the patient is being assessed by the doctor, and they will advise whether there's need for a test.
Okay.
There are some questions actually.
Yes.
Okay, Mr. Narasimha has asked me, after laser surgery, can the prostate still grow? What the intervals and whether surgery is necessary? Again, it's very difficult to answer this question in a solo. It's possible that it may grow again. And usually what we do is after the laser surgery, patient will be given medication to suppress the growth of the gland in benign prostatic hyperplasia. So it's less likely that it will grow. Again, it's a clinical assessment and decision based on that. And Dr. Mahesh has asked me to discuss about PSA levels between 4 to 10 ng. It's a very good question, sir. Yes, I did mention this. This is something called Prostate Health Index, which is a new group of tests which is available in some centers. I don't know whether it's available in India. So basically, it's a type of test where we look at different isoforms of prostate hormone. One is free prostate hormone, total prostate hormone, and there is something called the prostate hormone. The pro-prostate hormone is the one which is implicated in the risk of prostate cancer. As I said, it's very expensive test, and I don't know the exact cost of the test because I need to check that bit. But it's been made available to some patients. Most of the times, if we are concerned that the levels are high, we will not just rely on the second level of investigation. We'll proceed with the imaging and biopsy as indicated. This is for the patient who do not want to undergo any surgical intervention. So this is another way of seeing whether there is a chance that this could be a false elevation of prostate hormone. Okay, Mr. Shivakumar has asked me, my question is, which part of body the bone pain in advanced cases? Okay, let me answer this question in a different way. Prostate cancer can spread locally around the prostate into the urethral area, into the bladder, into the pelvic area, or into the pelvic bones. The most common pain will be in the lower part of the back. Or if it goes to the bloodstream, it can spread to any part of the body, including liver and lungs. As I said, it's a very advanced stage 4 disease when it spreads to different parts of the body. So early stages, you won't feel any back pain. If it is already spreading, then you feel the back pain. Any prevention delaying techniques available for prostate problem? Unfortunately, as in medical science, I can't really say that because it's a hormone-related condition and it's age-related condition. There's no specific intervention that we can suggest that reduces the risk of cancer. Most likely answer will be avoiding heavy fatty meal and reducing weight. The next question I have is, could pumpkin seeds and flax seeds reduce enlargement of prostate? I do not have answer for the question, sir. I'm not an expert in that. Yoga, I'm not sure. I don't know about these kind of things because I'm not an allopathic. I'm an allopathic physician and I don't have any experience in any of these things. Fomentation of lower abdomen. I have no idea what it helps. I'm sorry about that question. Okay, this is a good question, Mr. Ganesh. Fluid remaining after urination in age-adult, is there any possibility it can be avoided or practiced to follow? Yes, it's a very good question, sir. It's called, what do you call it as toilet hygiene. So we will recommend you to keep going to toilet frequently, even if you don't feel that your bladder is full. The more bladder is filled, the more difficult for them to pass urine. So you try to strain. It will put pressure on the prostate as well as the urinary system and pushes the bladder up. So that is when the urinary retention happens. So if they go to the toilet more frequently, then it's less likely to collect any urine in the system and less likely to cause problems with that. Mr. Tangraju is asking me direct message, which specialist doctor for this kind of ordinary prostate problem to be consulted? It could be a nephrologist or a urologist. Both will manage this. If there is a need for a urologist opinion, nephrologist manages the medical part of it. If nephrology feels that there is a need for the urologist to get involved, he will refer to urologist. You can go to either of the two. Okay. Dr. Mahesh's question, odds ratio of developing prostate cancer in BMI 25, 30, 40. I didn't check that out, sir. Sorry about that. Thank you, sir.
Sir, one common concern raised by many people is that does vasectomy also leads to prostate cancer?
Sorry?
Does vasectomy, the procedure of vasectomy, also lead to prostate cancer?
Vasectomy is a procedure to stop getting fertile again, right? Yes, there is, but there is no hormonal variation with that. Means you are only stopping the seminal movement and the spermatozoa movement, but still there is a production of testosterone hormone at the normal age levels. So it's less likely to be directly involved with the prostate enlargement.
Okay.
Is incontinence situation related to prostate? Yes, it's possible. Yeah.
So can I raise a straight direct question, sir?
Sorry, sir, can you come again?
Can I raise a direct question, sir? I asked.
Yes, sir, please.
Sir, is prostate, the development about this prostate, is it as a recent of origin or it's an old one now?
I didn't get it, sir. Come again, sir.
I'll come again. See, I'll explain the context in which it is coming. See, my parents, my father, he lived up to his 90 years. And you know, my father's brothers, etc., they also lived for a very long age. But none of them have come across this problem of, urinary incontinence or frequent urination in the nights or something like that. But in the next generation, immediately after that, almost all of us are having this problem. Is it something new, or was it not happening to them and it is happening to us? Is there anything connected with the age, doctor, or age, or any other related concerns? Am I clear, doctor?
You're saying that your father and your father's relatives had no problem with incontinence of urine or any urinary symptoms, but you say that the current generation are seeing this problem of incontinence and prostate disease. Is that right, sir?
Yes, doctor. This is a very serious concern in the current situation. Most of the people who are above 50, 55, they are complaining about this.
Because I think the answer will be because there's more increased screening here at this point of time. In the previous generation, they had no symptom, they wouldn't go to the doctors, they won't get investigated, they won't get evaluated. Now, everyone is going to the doctor for symptoms. Even if without symptoms, you do go and do a screening, health screening as well. So there is a possibility that increased diagnosis because of increased screening.
Oh, that is only because of that. Yes, doctor, I understand. That is because of the increased awareness. Maybe because of increased awareness.
Possibly, yeah.
So that explains. But at least, I have come across some tests, some kind of exercises. That is where they say that you can practice these exercises and, reduce the quantum of urination in the nights.
Sorry, I didn't get the question again, sir. Can you explain your question?
There is at least one exercise where they say that if you do that exercise regularly, the urine incontinence can be reduced.
Please explain that to me, sir. I don't know that thing.
You don't know that. But okay, doctor, because it's, I mean, we have one of our yoga specialists used to say that.
Okay.
I mean,
Yeah.
you have very clearly said that you are not an expert in that. Okay, doctor. So that helps, doctor. Thank you.
Thank you.
One question we have here in the chat that can I take Silodel D8 continuously?
What is this? Okay, this is a direct question. You need to ask your doctor, please. Thank you. Sorry.
Yes.
I don't know why you are taking this, and you need to speak to your doctor about this. I think this is not a question for this forum.
Yes. Is prostate cancer always fatal, sir, or any particular ratio of recovery to fatality?
It's okay. That's again a question depending on the seriousness of the situation. In early stages of any cancer, there is a good treatment options available. Patients do recover completely, and I mean, of course, there is a concern that it's going to come back again. As the disease is more advanced, more serious, of course, there is a risk of more serious complications, including fatality. There's a question about. Is prostate enlargement or prostate cancer comes to those who have diabetes and are hot element? Actually, it's not clear. There is no direct association described in the books. What we can only say is that increased fat diet and obesity have a slight preponderance for the what you call it as a syndrome X or resistance syndrome, insulin resistance, that is associated with many conditions that includes the prostatic enlargement. I don't know if it is prostate-specific antigen. Sorry, is it a prostate test particularly? But yeah, there is an association with what you call it as a high risk of the medical problems. So again, there is a private results-related question. I recommend you to please speak to your doctor, sir. I'm sorry about this type of a question. So your results, you should speak to your doctor, get an advice from them. I cannot advise without knowing your medical background about you.
Also, sir, I'm sorry if this issue was already addressed and I didn't pay attention, but how much does this condition run in families? What is the genetic angle to this?
There is no obvious proven genetic predisposition. There is only I would call association. There is no causation proven at this point of time. So if someone has got a family member who's got this condition, they've been advised, they're put into high risk groups and they will be screened more closely. If someone has never been his family has never not any exposure to this condition. It does not rule out the possibility of them getting this condition. It's again based on their symptoms and their assessment by the doctors.
Okay.
Mr. Vasudevan has asked me what medication we prescribe. I will be prescribing based on my patient's clinical picture, sir. So it's all depends on his medical condition, other medical issues, and his tolerance to the medications. Mr. Shivakumar is asking one should reduce water. In the contrary, sir, actually drinking more water in the daytime is better. I have only suggested to reduce the water intake in the nighttime because in the nighttime the bladder reflex is not so good and you cannot control the urine output. So then you tend to go to the toilet more frequently. It's just an inconvenience rather than a disease itself. So if you can drink more water in the daytime, that helps. And try to pass more urine more frequently in the daytime, that helps. Try to reduce the water intake in the nighttime so that you don't need to go to the toilet very often. Thank you.
Doctor, coming back to my question.
Yeah.
That is, the exercise is known as Kegel's exercise. K-A-G-E-L. Kegel.
No idea, sir. Sorry about that.
No idea. Oh, thank you, doctor. Thank you. That helps.
So one question I would like to ask is that since prostate cancer is one such cancer which grows slowly, so can we say that it is less dangerous as compared to other cancers which
No, sir.
grow more rapidly?
I disagree. I disagree with that. Any cancer is serious. So it should be, any cancer should not be taken lightly. It should be investigated thoroughly, confirm the diagnosis, treat accordingly.
Sure, sir, sure. Any other person from the participants would like to address any of their concerns or issues directly with the doctor? Anyone would like to further ask questions? So I guess we have reached.
Okay, there is a question by Mr. Sivakumar. If uric acid is more smells, I didn't get the question. Uric acid has got no relation with this thing directly. Uric acid is elevated in someone who's got high muscle turnover, and it can accumulate in the bones. It can cause what you call it as gout. So this is no relation to this. Uric acid, high uric acid can cause stones in the kidneys and urinary system and cause infection, urinary tract infection. There is no relation with prostate and uric acid directly. So.
Any other questions or concerns from any participant?
I'd like to thank Doctor for an excellent session. So it was an excellent presentation, and it is very useful for the seniors because there are lots of misconceptions about this prostate. Now, doctor has very clearly said that what are all the things that one need to be, concerned. There is no need for any worry. One needs to be concerned about what are all things and how to go about when somebody is really suffering from or seem to be suffering from this kind of prostate problems. I think that way I thank doctor for an excellent session. Thank you, doctor. Thank you. Thank you.
Thank you very much, sir. Good day to you all. Thank you very much.
Thank you everyone for joining this meeting. We expect that you would certainly be joining in our further sessions as well, as we conduct every Monday in Kannada and English, so as to improve our knowledge on the various aspects of elderly mental health. Thank you, everyone.
So I like to thank doctor once again for this. And from the seniors side, I would like to pray God to shower on him and his family all that are the best in his life. Thank you, doctor.
Okay, sir. Thank you, sir.